Aging Office Hour session. I guess we can start off with introductions. So my name is Caitlin Figueroa, Program Officer for the funds, and I'll pass it over to Chen Chen.
Hi everyone, my name is Chen Chen. I'm the program associate here. I'm gonna pass it to Albia.
Hi, folks. Albia Altina Gibson, and I serve as the director for the funds. Good to have you all here with us this afternoon.
Okay, so the objective of today's Healthy Aging Office Hours session is to understand the fund's Healthy Aging funding stream, as well as answer funding opportunity questions that you may all have. Okay, so the approach. So looking into the purpose of the funds. So we envision a Massachusetts where communities are transformed so that all residents have an equitable opportunity to have the highest quality of life possible. The Massachusetts Community Health and Healthy Aging Funds, or the funds, are committed to disrupting and removing barriers to health, structural and institutional racism, poverty, and deep power imbalances through community-centered policy systems and environmental change approaches. So the 8 domains of livability framework. So the Healthy Aging funding stream, as you know, supports strategies, or as you may know, that focus on the 8 domains of livability. So the 8 domains of livability framework is used by many of the towns, cities, counties, and states enrolled in the AARP network of age-friendly states and communities to organize and prioritize their work to become more livable for both older residents and people of all ages. So this diagram here depicts the 8 domains of livability. And for this particular funding stream, the cycle, we're prioritizing transportation and housing. And then as far as priority focus for a geographic focus, we are prioritizing gateway cities and rural areas that have not routinely benefited from previous local DON funding. So as I mentioned earlier, the Healthy Aging Fund supports strategies that focus on the 8 domains of livability, but it's intended to fund projects that also incorporate a policy systems and environmental change strategy or approach. And so this image here that you're seeing is showing a comparison between what we would think is a little more, or a project that's a little more programmatic in nature. And beside that, you'll see a way in which we can imagine that project incorporating a more PSC change approach. So I'll go over the first example here. So hosting a community bike ride. Obviously, that is, essential, obviously, for folks who have an interest in, joining the community, socializing, for many reasons, obviously, but still very programmatic in nature. And now a way in which we can envision elevating that to a more PSC level approach is implementing a complete streets policy to ensure community roads are designed to be safe and accessible for all users. And so just thinking about how we can elevate the work to be, to have more lasting change, right? So that if or when you no longer have the funds dollars, it's still creating an impact long-term for the communities. And I can go over another example if, yeah, so the second example we have here is having an open gym night at a local school. And a way that we can kind of elevate that, again, to incorporate a more PSC change approach is by implementing a town-wide joint use agreement, enabling community members to have access to the school's gym and fields when school is not in session. Again, this is long-term change. Next slide, please. Thanks, Shantan. And so just some examples of healthy aging awardee-related work in policy change, system change, and environmental change. So policy change, conducting a health impact assessment on policy and practice proposals that affect the ability of people with a criminal record, as shown through a criminal offender record information check, to secure housing. That would be a policy level change. Systems change, creating and disseminating a guide that promotes inclusive, age, and dementia-friendly practices with an overarching goal to encourage culture change that leads to communities more thoroughly considering the preferences, needs, and experiences of all people. That would be considered more systems level change. And then environmental change, addressing barriers to safe walkability in the region through policy advocacy, education, and environmental changes identified in walk audits. Okay, so here's an example of a current Healthy Aging awardee, community teamwork. And so their issue here, excuse me. So they've identified that affordable housing is a key social determinant of health. Numerous studies have shown that where they live matters greatly to your health. The financial burden of trying to maintain an unaffordable roof over one's head often prevents individuals and families from paying for other necessities such as adequate nourishment, heat, clothing, and healthcare. And housing instability can result in emotional, behavioral, and mental health deficiencies. So those who are at risk of or homeless see these health outcomes exacerbated. And some of the root causes of health outcomes for this particular issue are systemic racism and poverty, and their solutions and the approach they're taking to address the work. Some of them listed here are capacity building and training, so multi-sectoral and representative collaboration and action, specifically for this organization, adding capacity to reinforce important collaborative efforts, bringing together expertise to develop a joint advocacy agenda that is by and targeted toward organizations and municipal entities. The second solution being inclusive and representative leadership and participation, which looks like for them, the creation of local affordable housing coalitions, increased participation of people at risk of housing instability, increased participation by non-traditional stakeholders in each local housing coalition, and myth or stigma busting and public education through affordable housing 101 sessions in English and Spanish, and convening of all local housing coalitions. The third solution is fundraising for implementation of priority recommendations and actions. And then we have the fourth, which is a system of shared metrics and process for tracking progress. So the award length and amount. The Healthy Aging Fund expects to provide multiple awards of up to $100,000 over the course of 3 to 5 years. The planning grant, however, is a little different, where you can apply for up to $50,000 in funding for work that spans over the course of 1 to 2 years. So for the planning grants for healthy aging, the funds will take applications from organizations that seek to move from short-term, time-limited efforts to long-term sustainable approaches. Planning grants will support planning, technical assistance, capacity building, and learning for emerging healthy approaches. And recipients of planning grants are welcome to apply for a full grant in the next funding cycle. However, funding is not automatically guaranteed for planning grantees. And I think that someone at a previous Q&A had asked if applying for a planning grant makes you a more attractive applicant for a regular grant in a future cycle. And the answer to that is no, not necessarily. Again, this is a pretty competitive grant, generally speaking. So again, if you need a planning grant, that is, solely for if you're requesting funding for technical assistance, capacity building, things of that nature. And it does not necessarily make you more primed to receive funding for our non-planning grant in a future cycle. Okay, so now just looking into the actual grant making process and some dates associated. So during the application period, which we'll be launching sometime this week, so keep a lookout for that. You'll be receiving application supports, and then the deadline will be the 29th of March. So you'll have supports all the way from when the application launches to the day before the due date. And then the due date again is March 29th. And anywhere from 4 to 6 weeks after that deadline, you should expect to see a notification regarding the status of your application. And then awards will start in July of this year. So some next steps. I'm not sure if you all can see this calendar, but as mentioned before, we're providing some application support during the application period. And you can see a few dates here for office hours, TA sessions. I don't if Chenchin, if you happen to have the link or someone on my team to this PDF so folks can get a clearer look at it. There's a bunch of important dates here regarding support throughout this process for you all. And lastly, feel free to visit our website. Here you'll find a lot of information, resources such as the request for proposal, our frequently asked questions. So please, and this is also where you're gonna find the actual application link. So take a look around the website, familiarize yourself with a bit of these pieces, and then next slide. Feel free to stay in touch with the team using the matchoffunds@hria.org email. If you have any questions or would like to talk through anything with us.